Hello everyone. So today we are going to talk about centrally acting antihypertensive drug, that is methyl dopa, clonidine and gonadril. What is their mechanism of action? What is their importance and what is their side effect? And how these drugs alter the activities. We will discuss everything in this lecture. So, actually, these are antihypertensive drug and act on preganglionic neurofiber or neuron and stimulate alpha 2 receptor which inhibit the release of norepinephrine. So, methyl dopa, clonidine, and gonadril are antihypertensive drugs and use mild to moderate hypertension. So now let's come to the mechanism of action, that how these drugs alter the activities. So let's suppose this is central nervous system and consists brain and spinal cord. And this is vasomotor area or center and the medulla, from where the neurofiber are coming down and stimulate thoracolumbar outflow. So actually thoracolumbar outflow means the neuron or neurofiber that originated from thoracic and lumbar region, because spinal cord is divided into different regions like cervical region, thoracic region, lumbar region and sacral region. So sympathetic outflow is a thoracolumbar outflow. These are preganglionic neurofiber or neuron, and these are postganglionic neurofiber or neuron. They are going and stimulating heart, and some of them are going and stimulate smooth muscle of vein and artery, and some of them are going down and stimulate juxtaglomerulus apparatus system. So I will just show one pathway very large, and I am trying to illustrate it diagrammatically for better understanding. So let's suppose there is a neuron in this area. I will bring this neuron here and I will just show one pathway very large. So let's suppose this is preganglionic neurofiber. So this is preganglionic neurofiber and this is postganglionic neurofiber. So this is postganglionic neuron or neurofiber. Now on the wall of preganglionic neuroending, there is a special receptor is present, that is called alpha 2 receptor. Alpha 2 receptor. At play important role we will discuss later. Now, when action potential come or stimulus come, then these are this preganglionic neuroending release norepinephrine and stimulate next neuron or neurofiber. Now, at this point, main neurotransmitter is norepinephrine. But how? This norepinephrine is synthesized, stored, and released. They synthesize in the cell body of neuron and then transported here. Or they synthesize within the neuroending. So actually, they synthesize locally within the neuroending, right? So let's see the mechanism how this norepinephrine is synthesized. So listen carefully. Let's suppose this is GIT tract, gastrointestinal tract, and someone take proteinous food and it convert into simple amino acid within the GIT tract. From GIT tract, these amino acid absorb into general circulation. When amino acid enter into general circulation, it distribute all over the body and tissue. One of the amino acid that is tyrosine. When tyrosine come near the neuroending, there is a special tyrosine pump mechanism. A tyrosine uptake mechanism is present on the wall of neuroending, which pump tyrosine into the neuroending. Once the tyrosine enter into the neuroending and tyrosine concentrated within the neuroending, then enzyme come to action and work on tyrosine. Convert tyrosine into dopa. The enzyme tyrosine hydroxylase that convert tyrosine into dopa. Actually, tyrosine hydroxylase enzyme at hydroxyl group and the basic structure of tyrosine. So what is added over here? So hydroxyl group is added over here and converted into dopa. Now another enzyme come to action, that is dopa decarboxylase, that remove carboxyl group from the basic structure of dopa and convert into dopamine. So dopa convert into dopamine. Enzyme dopa decarboxylase. So dopa decarboxylase convert dopa into dopamine. Now once the dopamine is formed, it directly pump into vesicle. There is large number of vesicle present within the neuroending and dopamine pump into vesicle. On the wall of vesicle, there is a special vesicular transport system is present that pump dopamine into vesicle. So as soon as dopamine is pumped, it directly pump into vesicle. This is because if dopamine remain in the cytosol or outside the vesicle, the enzyme monoamino oxidase destroy dopamine, because this enzyme destroy or oxidize low molecular weight neurotransmitter. So for the prevention of this mechanism, it directly pump dopamine into vesicle. So on the surface of mitochondria, there is a special enzyme present that is called monoamino oxidase that destroy low molecular weight neurotransmitter. So for the prevention of this mechanism, it directly pump dopamine into vesicle. Once the dopamine enter into vesicle, another enzyme come to action and convert into norepinephrine. Then norepinephrine form complex with some protein and ATP. So normally this phenomena occur. Norepinephrine synthesize and store within the narrow ending. Now, when action potential come, this vesicle fuse with membrane fuse and release norepinephrine and stimulate next neurofiber or neuron. So now let's come to drug. Let's suppose someone take methyl dopa. When we provide methyl dopa to the narrow ending, methyl dopa, then methyl dopa replace the place of dopa. Then this enzyme dopa decarboxylase instead of dopa take methyl dopa and convert into methyl dopamine. Methyl dopamine instead of dopamine. Then another enzyme, then instead of dopamine, methyl dopa is formed into vesicle. Methyl dopamine. So now another enzyme that convert dopamine into norepinephrine take methyl dopamine and convert into methyl norepinephrine. Methyl norepinephrine. So now methyl norepinephrine is synthesized within the narrow ending. When action potential come instead of norepinephrine, this neuron release methyl norepinephrine. Methyl norepinephrine. And this methyl norepinephrine strongly stimulate alpha 2 receptor at work on alpha 2 receptor. Methyl norepinephrine at work on alpha 2 receptor. When alpha 2 receptor is stimulated, it inhibit the further release of norepinephrine. So norepinephrine is not released because methyl norepinephrine stimulate alpha 2 receptor and alpha 2 receptor inhibit further release of norepinephrine. So this is biochemistry of narrow ending and methyl dopa. Now let's see the physiological changes occur in the body. So let's come to diagram. All these drugs inhibit or fail the narrow ending. Like methyl dopa, clonidine also stimulate alpha 2 receptor. Clonidine and methyl dopa same mechanism of action, but clonidine directly stimulate alpha 2 receptor and inhibit the further release of norepinephrine. So what happened actually when vasomotor area inhibited, it inhibit sympathetic outflow, thoracolumbar outflow. When thoracolumbar outflow is inhibited, then the neuron that are going toward the heart is inhibited, which work on SA node of heart. Then contractility of heart is reduced. When contractility of heart is reduced, then cardiac output is reduced. When cardiac output is reduced, then BP go down. BP is reduced. Another function, when vasomotor area is inhibited, then thoracolumbar outflow is inhibited and the neuron that are going toward the smooth muscle of vessel when an artery is inhibited, as a result, motor tone is inhibited. When motor tone is inhibited, then blood vessel is dilated. When blood vessel is dilated, then BP down. BP goes down. This is another function. Another function, the neuron that are going to weld the juxtaglomerulus apparatus system, it inhibit the release of renin. As a result, BP goes down. So, methyl-dopa and clonidine is antihypertensive drug and at work on alpha 2 receptor and stimulate alpha 2 receptor and inhibit the further release of norepinephrine. So now let's come to another drug that is reserpine and guanadril. Their mechanism of action is slightly different from methyl-dopa and clonidine because guanadril and reserpine work on postganglionic nerve ending, where nerve supply to the effector organ. So let's suppose I am showing this relationship diagrammatically large. So this is postganglionic nerve ending. And this is effector organ. For example, muscle, smooth muscle of heart or vein. You already know that tyrosine form dopa and dopa convert into dopamine and dopamine form into vesicle and within the vesicle dopamine convert into norepinephrine. When action potential come, this vesicle fuse with membrane and release norepinephrine which act on effector organ. For example, muscle. Now, actually what happened when norepinephrine perform its function, it come back and enter into narrow ending. Within the narrow ending, some remain outside and some enter back to vesicle. The norepinephrine which remain outside the vesicle is destroyed by monoamino oxidase enzyme. Now, when guanadril drug is given to a patient, it also follows same pathway. Let's suppose this is guanadril, it enter into narrow ending and go and enter into vesicle. When guanadril enter into vesicle, it push or kick out norepinephrine. Norepinephrine and vesicle full of guanadril. All the norepinephrine push up by guanadril. As soon as norepinephrine come outside, it directly destroyed by monoamino oxidase enzyme. Now, when action potential come, this vesicle release guanadril instead of norepinephrine. So as a result, narrow ending is pale. Action potential is pale within the narrow ending, and cardiac output is reduced, muscle is dilate, and blood pressure goes down. Another drug that is reserpine. Reserpine also come into the narrow ending, and actually reserpine block the vesicular transport system from which dopamine enter into vesicle. So reserpine block this transport system. As a result, dopamine remain outside in the cytosol and destroyed by monoamino oxidase enzyme. So monoamino oxidase enzyme destroy dopamine and it block vesicular transport system. So this is the mechanism of reserpine.